Doctors have gone on strike, but their demands are unclear. Do you know how many things I have to sign? Today, we are breaking down and reacting to the wildest medical memes that were found on Discord. All right, let's dive right in. Doctors. Does it hurt when I do this? You're trying to say that we as doctors are a little brutal when we do procedures? You know, for me, I can only speak for myself. There are procedures that we do that are uncomfortable and painful. We're using needles, we're using sharp objects. It's going to hurt. So I actually am quite honest and actually probably lean more towards the side of telling somebody this is going to hurt, but it's only going to hurt for a short period of time. I think the worst discomfort is, say, the injection of the anesthesia, which is like lidocaine, because it actually causes a lot of pain. It has to do with the temperature. Lacking vitamin U. Oh, like you're missing somebody or another person. I was thinking like play on like uremia or uric acid. You do have to be careful. If you're not getting a balanced diet in general, you could be missing some important vitamins. So please make sure that you have a balanced diet. And sometimes you can actually ask your doctor to do a type of vitamin panel. The most important one we really check for is a vitamin D, just because you have to worry about some vitamins, A, D, E, and K. Bro looks like he's covered in peanut butter. Doesn't look like peanut butter. It just looks like the fat percentage of this body is probably so low that you're seeing all these vessels that are just underneath the skin. Maybe the peanut butter due to the color? I don't know. Bodybuilders have like a significant amount of veins where they're very large because of demand that they're requiring to get oxygen and blood to the tissue by what they're doing by building muscles and heavy lifting, but also because they have a reduced amount of body fat as well. So that combination, they start to be more prominent. Healthy lungs, lungs of a vegan. So we got asparagus and some citrus fruit versus the normal appearing lungs on the left side. But they're not actually that normal in appearing, right? The right side should have 3 lobes and the left side would have 2 lobes plus the lingula. So they're a little off. They're very much a mirror image of each other. So yes. Successfully becomes a doctor after cheating in online school. Patients in 2040. Yeah, no bueno. I don't think you can actually take all your courses for medical school online. Thus, there's really not much cheating. It depends what you mean by it, but if you have the answers, no, that's cheating. But trying to write notes and things like that, not necessarily cheating per se, but this meme is quite interesting in the sense of like, if you're cheating now, you're cheating yourself and your patients later, right? Embarrassed? Don't worry, I'll just pump more blood to your cheeks. So typically when somebody is embarrassed, usually somebody would actually get flushed, meaning more blood to your cheeks and to your skin. But very good picture of the heart. You got the coronary vessels on the outside and the appropriate ventricles, and you see all the other tubing and structures thereafter. Very cool looking. Human anatomy is amazing. Label me like one of your French girls. Huh? It looks like it's got the lines to label structures of the anatomy of this skeleton. I am not sure what this is referencing, but the skeleton is in a very seductive position. The label me part, that's more up my alley because I know what that means. You have structures that you need to label skeleton wise. Yes, in medical school, we would have to know every single thing in the human body. The doctor with my balls. I'm assuming we're pushing too hard, but we're not trying to push too hard. Yes, we don't know the discomfort per se, but we're trying to feel for masses or inflammation or types of infections by doing a palpable exam of the testicles. But it is really, really important that you do self-exams almost every day of your life, at least when you're in the shower, because you want to make sure that you don't feel any abnormal lumps that weren't there. The easiest way to get rid of cancer is to get early detection or have early detection so then it can be treated immediately versus waiting. Doctors have gone on strike, but their demands are unclear. Do you know how many things I have to sign by any legal measure? As long as you can identify that it is actually your handwriting, then it's fine. But when it comes to instructions, it needs to be legible so people can understand what you have written out. Luckily now we have a lot of EMR, electronic medical records, so most of the things that we jot down and write for people is actually just from the computer, so you can actually read it quite easily. Doctors be like, This is a dangerous place. An apple a day keeps a doctor away. Apples are really good for you. They're good for your teeth. They're good for your health. They're good for your digestion. Definitely take an apple over a candy bar. At the doctor's office, Mom, please don't touch anything. Toddler, licking everything. It is so true. Touching everything, surfaces, licking. Oh my gosh, we do our best to not have them do that. The hospital is clean, but maybe a person just came right in there and vomited or peed on the floor. We're using pretty good industrial cleaners. We're using UV lights, a lot of things to kill everything, but still gross enough. So please don't lick, touch anything. Make sure you wash your hands. There's plenty of those hand sanitizers everywhere, as well as sinks with soap. Me. What can I do to get healthier, doctor? Doctor, use a bicycle and cut the carbs. Oh my gosh. I'm a New Yorker. We love pizza, but you do have to be careful. Excess amount of just pizza in itself. You got tomato sauce, you got cheese, you got fats, but just make sure you're not eating too much. And yes, exercise has been proven to make you healthy. Losing weight is not just exercising. It's more related to calories in, calories out, what you're actually eating. But exercise, keeping your heart going, and it's actually been proven to increase longevity. When I call it a hematoma instead of a bruise. Oh, got my glasses on. Hematoma, contusion, and ecchymosis. All terms that we use to kind of describe a bruise. Hematoma is typically a big collection of blood under the tissue, and usually it's a lump. Versus ecchymosis, it's more of a bruise. Contusion is typically underneath the skin, kind of lumpy bruise as well. So they all kind of mean the same thing, but an ecchymosis is actually more synonymous with a bruise. Not sure if patient is severely delusional or the most interesting man in the world. Sometimes when we describe delusional, we're meaning somebody who is having maybe really bad exacerbation of schizophrenia versus is there psychosis going on from a medical condition. There's a lot of different things, but sometimes you're having conversations with these people and they're quite intellectual. They have good ideas, but they might just be down one road or the other that just doesn't seem right. When you're trying to convince your dementia patient that there are no meds in their food. Looking at the med just off the top of my head, I see a 10-325. That is an opiate, okay? The 325 is the Tylenol or the acetaminophen, and the 10 could be oxycodone or hydromorphone. And then you see the one that's yellow with the pieces, that's actually like a street drug that we call a Xanibar. Super easy to use a pill identifier and just Google it or look it up and they'll tell you what exactly the medication is, but you wouldn't be giving these medications to a demented patient. Waking the patient up to give meds at 4 a.m. in the morning, be like, ah. Are we waking the patient up and screaming at them, or does the patient wake up freaking out and scream? All I know is when I go to wake up a patient when they're passed out and sleeping at the hospital, it's a gentle shake, usually to the foot. If it's not working, then the shoulder, and then you start to get loud to try to wake them up. And usually the patients are quite disoriented because you're not sleeping in your normal place that you would normally sleep. So you have to give people a second. Did you hear that ICU bed 5 has maggots in an open wound? Me? Normal people. This is a thing. Maggots occur in wounds. The big question everybody always asks is, did the maggots grow there or did they like flock to the tissue? Hard to know sometimes, but maggots are actually good for dead tissue because they're actually cleaning the wound and cleaning and eating the dead tissue. Now, I've seen many patients with maggots in different wounds in my life, and some there's a few, some there's hundreds. My reaction to it is always the same, and same with all staff. Every staff member does look like the me version of like, I want to see, I can't believe it, versus normal people are just like disgusted and baffled. All right, so memes from Discord. I appreciate those who are on my private Discord server. Definitely check it out if you're not. A lot of fun stuff there, and it's monitored, so that is good. We take questions from people who post them on Discord, and even the memes come from Discord. So if you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Check out Life Happens, my new exciting supplement company. Thank you so much for watching, and stay healthy, my friends.